Hi everyone, my name is Dr. Lee Jun Long and I'm from Paddington Medical. I would like to share with you today about influenza. So, influenza is not just the regular flu, it's actually way worse than COVID. From someone who has gotten influenza before, as well as COVID, in my opinion, it's actually way worse than actually COVID. So, I'd like to share with you about the main symptoms of influenza, diagnosis, and treatment of influenza in our clinic. So what you will learn today is actually the main symptoms of influenza, how is influenza diagnosed and treated in Paddington Medical. How common is influenza nowadays? Um, because we do a lot of viral testing in Paddington Medical, and over the last 7 months, we have compiled the data about all our patients who see us for respiratory infections. So you can tell the yellow bars do show the number of respiratory infections, and the blue line shows a big uptick in the number of influenza cases that present to our clinic. They are diagnosed and treated in our clinic. There is a big uptick in January and February, and therefore I would like to share with you about influenza. So the main symptoms of influenza include a high fever, it's usually more than 38 degrees Celsius, and sometimes even hitting 40 degrees Celsius. And usually the body ache and chills predominate quite a lot, with uncontrollable shivering. A sore throat or scratchy throat is usually present, and the most defining feature that, in my opinion, is actually a blocked nose and or a runny nose. And sometimes most patients have uncontrollable dripping and a stuffy feeling at the back of the throat. Surprisingly, cough is not a major symptom, but it does present in patients from time to time with influenza. So the next slide actually shows a video of how influenza testing is done in our clinic. Once we've obtained the sample from the posterior nasal pharynx, means the back part of the nose, now we need to dilute the sample. This video actually shows me after I obtained the sample from patient.
So let's take a look. So once we obtain the sample,
Okay, we just put it inside a diluent itself.
we'll just put inside and then we'll stir. Once it's ready, okay, it's all done. Stir it for a few seconds, squeeze out all the viruses out, okay. So that's done, okay, and we'll keep this dirty stick one side, okay. So once all these things are all ready, we'll open up the test kit right now. Okay.
So once we open up the test kit, we actually do other tests
we will
also.
put this inside the different diluents,
If indicated.
okay, and then we'll run the different samples, okay, and then we'll see what shows up. Okay.
Once we've obtained the so as you can tell, the blue one is actually for influenza, the next one is for RSV, respiratory syncytial virus, as well as the last one is for adenovirus. We do these tests only if indicated, and the test result takes about 5 minutes.
We'll go inside here.
It's pretty rapid.
We'll just put.
So let's just focus on influenza today. The first one shows actually a C line, which means it's an accurate test, but it's a negative test for influenza A and B. The second one shows influenza type B, and the third one shows influenza type A. Next, treatment of influenza. Once a patient is diagnosed with influenza in our clinic, if indicated, we will prescribe Tamiflu to help to reduce the severity and duration of the influenza symptoms, the body ache, the chills, the fever, runny nose, and stuffy nose. It's most effective only within the first 48 hours of symptom onset. That's why I would advise you to seek medical attention once you have any of these symptoms. After starting Tamiflu, please take plenty of rest, stay hydrated, and take the rest of the medications to relieve the different symptoms. When to seek medical attention again? Follow any advice you have from your doctor, and you have any difficulty breathing, vomiting, confusion, or any other concerning symptoms, seek medical attention immediately. Lastly, after getting influenza once myself, it's very memorable for all the wrong reasons, and therefore I would highly recommend vaccination for influenza. This brings me to the end of my short presentation. I hope you learned quite a bit about influenza, and if you have any concerns regarding your health, please do seek medical attention. Otherwise, stay safe, stay healthy.